Strokes are often heralded by sudden, dramatic symptoms. But what about those silent signs that slip beneath the radar? It remains one of the leading causes of death and long-term disability worldwide. According to the World Health Organization, approximately 80 million people have survived a stroke, with nearly 12 million new cases occurring annually. Understanding the silent signs of a stroke is crucial for timely intervention, potentially saving lives and reducing the severity of long-term effects. The brain is a complex organ, and even minor strokes, often referred to as transient ischemic attacks, TIAs, can go unnoticed. Such silent strokes may not elicit dramatic symptoms, yet they can result in significant brain damage. Recent studies suggest that as many as 25% of all strokes could be silent, silently robbing individuals of critical cognitive abilities without any overt warning signs. Understanding these subtle indicators is essential for prompt intervention. In the realm of neurological health, the symptoms of a stroke can often be misinterpreted or overlooked, leading to debilitating consequences. So, what are these insidious signs, and why should they command your attention? First, consider the oft-ignored symptom of sudden numbness or weakness, especially on one side of the body. Research indicates that approximately 72% of stroke patients experience this sign. This transient sensation requires immediate medical consultation, as it may rapidly escalate into more severe issues. Sudden numbness or weakness, particularly on one side of the body, represents one of the silent signs of stroke that warrants immediate attention. Research underscores the urgency of recognizing these symptoms, as they can indicate a significant disruption in blood flow to the brain. According to the American Stroke Association, rapid response is crucial. When treatment is administered within the first few hours, the chances of minimizing brain damage increase substantially. Next, dizziness or loss of balance can signal an impending stroke. Studies have revealed that fluctuations in equilibrium are significant predictors of cerebrovascular accidents. Such symptoms must be taken seriously, as the brain's vascular integrity is compromised during these episodes. Research indicates that approximately one-third of stroke patients experience these silent signs prior to or during an event. According to the American Stroke Association, dizziness is often linked to the brain's vestibular system, which can be compromised by reduced blood flow during a stroke. Studies have shown that individuals displaying sudden dizziness or balance issues, particularly when accompanied by other symptoms such as facial drooping, weakness, or speech difficulties, should seek immediate medical attention. The National Institute of Neurological Disorders and Stroke emphasizes that swift recognition and response to these signs can significantly reduce the long-term impact of a stroke. Therefore, it is crucial for individuals to understand that seemingly benign symptoms like dizziness should be taken seriously, as they may represent a critical medical emergency. Moreover, confusion or difficulty speaking can be subtle yet critical signs. The National Institutes of Health, NIH, emphasizes the urgency of recognizing these cognitive changes. Immediate medical evaluation is paramount to prevent further neurological damage. Research indicates that approximately 30% of stroke survivors experience some form of aphasia or speech impairment, which can manifest as slurred speech or challenges in forming coherent sentences. The American Stroke Association emphasizes the urgency of recognizing these signs, noting that timely medical intervention can profoundly impact recovery outcomes. Neuroscientific studies reveal that strokes disrupt the brain's communication pathways, leading to these symptoms that may not be immediately recognized as critical. Family members and caregivers should be vigilant, as even subtle changes in speech or sudden confusion can signify a declining condition. Understanding that these signs are alarms for immediate medical attention can enhance survival rates and reduce long-term disabilities. Recognizing and addressing confusion or difficulty in speaking is crucial in the prevention of irreversible damage during the critical onset of a stroke. Visual disturbances often go unnoticed. Blurred or double vision can indicate a stroke's onset. Research shows that about 30% of strokes affect vision, reinforcing the need for vigilance about unexplained changes in sight. Visual disturbances can serve as subtle yet critical indicators of an impending stroke, often overlooked by individuals unaware of their significance. Research has illustrated that alterations in vision, such as blurred vision, double vision, or sudden loss of vision, can occur due to disruptions in the brain's vascular supply. A study published in the journal Stroke highlights that approximately one-third of stroke patients experience visual changes at onset, making it a pivotal symptom to recognize. These disturbances may arise from the brain areas responsible for processing visual information being compromised, leading to transient ischemic attacks, TIAs, or full-blown strokes. Consequently, it is imperative that individuals remain vigilant to such signs, as swift recognition can facilitate timely medical intervention, significantly improving outcomes. Having an intense headache without a known cause may serve as a red flag, particularly among individuals with elevated risk factors. A study published in the journal Stroke indicates that while headaches are not the most common indicator of acute strokes, they are critical, particularly in cases of hemorrhagic strokes. Researchers found that nearly 25% of individuals experiencing spontaneous intracranial hemorrhages reported sudden, severe headaches that felt markedly different from usual headaches. This phenomenon is often characterized by an abrupt onset and intensity that can be described as the worst headache of one's life. Such headaches may result from the sudden rupture of blood vessels or increased intracranial pressure and can be accompanied by other symptoms, such as weakness, confusion, or difficulties with speech. Recognizing this headache as a potential warning sign provides an essential opportunity for early intervention, underscoring the importance of seeking prompt medical evaluation in such circumstances. It's critical to understand the significance of this warning sign. Another unusual, yet concerning symptom is difficulty comprehending speech or following conversations. Comprehending speech or following conversations can be a significant challenge for individuals experiencing a stroke, often manifesting as one of the silent signs that should not be overlooked. Research indicates that stroke can affect the brain's language centers, impairing an individual's ability to process spoken language, resulting in difficulties in understanding or responding to conversational cues. This symptom is particularly concerning, as it not only affects communication but also significantly impacts social interaction and emotional well-being. According to the American Stroke Association, changes in speech or understanding are frequently subtle and may not be immediately recognized as indicators of a serious medical condition. Early identification of these signs and swift medical intervention can dramatically improve outcomes and potentially restore communication abilities. Thus, being vigilant about such silent signs of stroke is crucial for timely intervention and rehabilitation. Additionally, fatigue or sudden lethargy should not be dismissed lightly. Studies have noted that nearly 30% of stroke patients report overwhelming fatigue as a precursor to their condition. This silent sign may frequently be attributed to lifestyle factors, rather than viewed as a precursor to a serious health incident. Fatigue or sudden lethargy is a subtle yet significant symptom that can indicate a stroke, often overlooked in its early stages. Research indicates that up to 50% of stroke patients report sudden fatigue as one of their initial signs. This lethargy may present itself as an unexplained decrease in energy levels, a sudden inability to perform routine tasks, or an overwhelming sense of tiredness without physical exertion. The biological mechanisms underlying stroke-related fatigue are linked to the brain's impaired ability to regulate energy levels. Such symptoms necessitate immediate medical evaluation, as rapid intervention can significantly improve outcomes for individuals affected. Recognizing and addressing these silent signs promptly increases the likelihood of receiving early treatment and reduces the risk of long-term damage. It is essential for both individuals and caregivers to remain vigilant and recognize that unexpected fatigue could be a precursor to a more serious medical condition. Lastly, loss of coordination in regular activities can be subtle yet telling. As reported by the American Heart Association, this symptom, albeit easy to disregard, can precede a serious event. Research indicates that the brain's ability to communicate with the body can be severely affected during a stroke, leading to impaired motor skills and balance. A study published in the journal Stroke elaborates on how individuals may experience difficulties in performing everyday tasks, such as walking, buttoning a shirt, or even holding a cup. These challenges arise from disruptions in the brain's neural pathways, which can affect one's proprioception and overall coordination. In conclusion, recognizing these silent signs of a stroke can mean the difference between recovery and permanent disability. By fostering a proactive approach to awareness, we can navigate the often overlooked indicators of this medical emergency. Stay alert, for early action can save lives. Please don't forget to like, share, and subscribe.